go ahead, and then Sara joins, she can jump in at any time. But thank you so much for joining us today for our state and federal updates. We're so excited to have Nicole Jorwic from the ARC of the United States and Sara Kugler from Senator Warren's office. We hope will be joining soon.
Just joined.
Oh, great.
Or should be joining any
Sara,
second.
she may be connecting right now. So I'll just quickly go over our agenda for today. So we have Nicole and Sara that we're so excited about that are going to be talking about the Better Care and Better Jobs Act and
oh, Ellen, sorry, you're muted. Can you unmute? Sorry.
So we'll talk about the Better Care and Better Jobs Act, and if there's any other additional congressional updates from DC that they want to discuss. And then Maura's going to go over the results of our fiscal year 2022 budget and our priority bills that we've had recent hearings on, and then our advocacy efforts. Just want to make sure everybody's muted. And then I'm going to go over quickly our Innovation and Technology Task Force report and recommendations that we have submitted to DDS. If we have time at the end. I know we've got a packed agenda and we really want to talk about the Better Care and Better Jobs Act as much as possible and have you guys ask any questions of Nicole and Sara. So Sara, if you're on and able, do you want to get started? I put together a few slides on the bill and have some information from Massachusetts that I have prepared, but you can go ahead and just talk about the bill.
Yeah, hi everyone. I'm happy to join this fantastic group and share a little bit about the Better Care, Better Jobs Act, which is led by Senator Casey in the Senate, and Senator Warren is a very proud co-sponsor of the legislation and fighting for the $400 billion that the president proposed to improve and transform HCBS is a key priority for her. So I will spend just a brief kind of split talk through a little bit just about the structure of the bill, and then I think probably the most important piece that you guys are interested in, maybe not. After that, I'll kind of briefly speak about process, like where we are in terms of the next stages of this moving legislatively. I will note ahead of time that I am the senator's labor staffer, not her health staffer. And so if there are questions at the end, more specific on the health side, I may need to circle back with folks on those. So the Better Care, Better Jobs Act calls for a $400 billion investment in investing in home and community care. And I think about it in kind of two phases. One is the planning phase and one is the implementation phase. So on the planning phase, the bill provides $100 million in 2022 for states to develop plans and expand access to Medicaid, HCBS, and strengthen the HCBS workforce. And during that period, states would receive the same 10% FMAP bump that they have been receiving through the American Rescue Plan. And if people are interested, I'm happy to share a little bit more about what those plans need to include, but overall, it includes an assessment of the existing HCBS landscape, a plan for doing annual kind of analysis and reporting, and about how the state would implement the goals for HCBS improvement. And those plans have to be developed with input from stakeholders through a public notice and comment process, and they would be posted publicly online. So I think those two pieces are quite important. And when states receive planning grants, they have to comply with a maintenance of effort that restricts them from reducing eligibility or benefit standards for HCBS. The next stage is the implementation phase. So once the government approves a state's HCBS plan, then that state becomes known as an HCBS program improvement state, and it receives a permanent 10% FMAP bump for delivering HCBS and for enhanced funding for administrative activities that are associated with improvement efforts, because we know that's really important to the success of those HCBS improvements. In order to receive that money through those plans, states have to have maintenance of effort. So for example, like not lowering the amount, duration, or scope of available HCBS services. They have to address access barriers and disparities in access and utilization, expand financial eligibility for HCBS, provides presumptive eligibility for HCBS. That's kind of a no wrong door approach, and a series of other requirements related to increasing access to services. And they also have to strengthen and expand the HCBS workforce. So that includes provision things like adopting processes to ensure that payments for HCBS are sufficient to ensure care and services are available, addressing insufficient payment rates for the delivery of HCBS with an emphasis on recruiting and retaining the direct care workforce, and updating payment rates for HCBS services at least every 2 years through a transparent process that involves stakeholder input, including recipients of home and community-based services and family caregivers of such recipients, as well as other folks like providers, healthcare plans, direct care workers, and chosen representatives of direct care workers. There's also an optional implementation piece that states can opt into if they want, that provides an additional 2% FMAP bump for those states for a period of 1 year. And in order to do that, the state has to establish a new program or contract with a nonprofit programs in order to register qualified direct care workers and assist beneficiaries in finding direct care workers, take activities to recruit and train independent providers, to enable beneficiaries to direct their own care, to ensure the safety of and quality of care to beneficiaries, and to support beneficiary hiring of independent HCBS providers through an agency with choice or a similar model. And a few other pieces. So that's kind of an optional thing that we would hope states would take up because of that additional 2% FMAP bump. That really helps further expand the HCBS workforce. And we know that like the title of the bill, better care, better jobs, that those two things go hand in hand. So that is oh, look at these amazing slides. Just predicting what I'm going to talk about. Fantastic. I had no part in these wonderful slides. So yes, all of these things, anything that I did not mention as I'm kind of just going through some top line summaries, there's other pieces in the bill as well in terms of the requirements. It's a strong piece of legislation. So that is the bill itself. In terms of policy, so the president has proposed this as part of his Build Back Better plan, and the Senate or Congress is planning, in the process of planning to move towards legislation that's kind of enacting the Build Back Better plan through what's called the budget reconciliation process. This is a process that's available on very few occasions, often just 1 or 2 a year, that allows legislation to pass through the Senate with a simple majority, which just means with 51 votes or a majority of votes. That's important because most of the time, as you guys all know, legislation is unable to pass the Senate because of the Senate filibuster, which requires 60 votes in order to bring a bill forward to be considered for passage, which requires every Democrat and at least 10 Republicans voting in favor of that piece of legislation. With the reconciliation process, if all 50 Democrats vote in favor of advancing the legislation, the vice president can, and all 50 Republicans vote against, the vice president can come in and break the tie as the 51st vote, which will allow the legislation to advance. That's what happened with the American Rescue Plan. That also used the budget reconciliation process. And we saw similarly that it was a 50-50 vote with a tie-breaking vote. It is like a somewhat weedy technical legislative vehicle, and the process of it also takes a while. So I think what we're anticipating happening is that sometime before the Senate leaves for the kind of extended summer state work period, so right now we're working through a bipartisan infrastructure bill. I think the expectation is when we're finished with that, at some point. We don't know the timing yet. I think that like what I read in the news this morning is like potentially we'll finish that over the weekend or early next week. But again, everything is very fluid. I don't know any better than you guys know on this. That as soon as we finish the bipartisan infrastructure package, we will move to the budget resolution. Now, the budget resolution just sets like the top line budget dollar value for each committee. And then there's an all-night vote-a-rama where people attach kind of amendments that like may or that kind of go into the resolution. But it's more of a period where I think the important thing to pay attention to is the dollar values associated to the committee, but it's not the moment at which we're passing the actual piece of legislation. When you go through budget reconciliation, there's actually two of those kind of like all-night vote-a-ramas. So we anticipate before going to recess that the Senate will do the first one, which will just establish the top line. And at that point, we're not even going to see like by program, right? Like how much money is being allocated to each individual thing, much less the kind of specifics of those programs that are in the Better Care, Better Jobs Act. That's going to happen when we come back from the August recess. The House has to pass the budget resolution. Then we'll come back and do the actual bill that like aligns with those dollar values in the budget resolution. So all of that just to say there's a lot of time. We still have a lot of time ahead of us in this process. We're going to take a really important step forward. We plan to take a really important step forward before the August state work period, but that won't be the point at which this bill is kind of like close to getting passed. It's just a step closer to being included in a package. And I think I probably talked a lot, so I'm going to stop there, but happy to answer any questions later.
Thank you, Sarah. Before I go into the questions, I see there's some in the chat. I just want Nicole to have a chance. Nicole is the Senior Director for Public Policy at the ARC of the United States. She's also the Senior Executive Officer for State Advocacy. And we asked her to join just to give the advocacy perspective from DC and talk a little bit about what the ARC of the US has been doing for this bill. I know that we've been working on it for a long time, so.
Yeah, I was glad to have Sarah on because she explained the budget reconciliation pieces much better than I would have stumbled through them. So, but the mechanics of the bill have obviously already been laid out. The ARC of the United States has been involved working with Senator Casey's office, as well as Representative Dingell's office on the House side to get the legislation drafted. And we're really glad and obviously very thankful for Senator Warren being one of the first to sign on and support, and the fact that 40 Democratic senators got onto this bill within 48 hours is a real testament to all the work that ARC of Massachusetts and other disability and aging and labor advocates have been doing to really talk about what COVID exposed in terms of what we really need to fix within the HCBS delivery system. And so I think the fact that it's both addressing access to services and the workforce issues is incredibly important, because you really can't fix one without the other. We don't know when recess will officially start, but when it does, the ARC of the United States will be putting out letters to the editor on the workforce issue, on waiting list issues, on other HCBS issues, so that we encourage everyone to send those out yourselves. Send them to your family, send them to everybody, because just as much as the Time Magazine or New York Times articles that come out, those LTEs in local papers are really important to senators and representatives, and so those are really important. We'll also be sending around graphics and state level fact sheets about things like how many jobs this bill would create in Massachusetts, how many family members who are filling in the gaps in services could go back to work because of this bill. So we will be sending around materials like that so that you're well armed and ready to talk about this bill. But the biggest pieces are really just talking about your own story, about why these home and community-based services matter to you or your family member, because ultimately what it's about doing is solidifying the system that right now isn't serving enough people and certainly isn't serving enough people in the community. So those are just a few things I would add as far as the things we'll be able to support with as recess comes hopefully soon, for I'm sure Sarah's sake, and I know I need a break too.
Well, thank you for all the hard work you're doing. In the first slide, I put in the action alert that you guys have going out, and I had some statistics from Massachusetts. I think one of the questions, I just want to go to the chat and then open it up for people to ask questions directly to you two. Statistics on group home residents similar to nursing home. I'm not sure if is it broken out to group home?
No. So the unfortunate reality is that because, and actually Senator Warren introduced, I work with Susanna in Senator Warren's office to try to work on this, because right now the federal government all during COVID has been requiring reporting and data collection on infection and death rates in nursing facilities, but has not extended that to the residential settings that serve people with disabilities and serve people with mental health issues, et cetera. So we still need to address that. There has been some data though that actually shows that it's not true around when we're talking about group homes being small community-based settings, that actually the infection and death rate was lower. There's a study from Dr. Scott Landis out of Syracuse University that showed that the larger the setting got, the higher the infection and death rate. And so we don't, unfortunately, because we're not requiring that data collection, we don't have it solidly, but it is very safe to say that the larger the setting, the more dangerous that it is, based on the study that Dr. Landis did. I can find it and put it in the chat.
In terms of, I'll just jump in for a sec. In terms of Massachusetts, I don't have the death rates, but I do know that in our group homes, we had about a 20 to 27% infection rate, which is higher, you know, than the typical population, obviously, but not as high as the nursing homes.
Certainly there was still a higher rate, but that's an important point, Maura.
So, Jossie, is revolution the same as reconciliation?
I think you probably meant resolution.
Yeah.
Yeah, I'm happy to take that one. So no, but yes. To answer really clearly, sort of. The budget resolution basically kicks off the reconciliation process. It is the vehicle that allows for a bill that is eligible for the budget reconciliation process. So yes and no. If that, I'm happy to kind of follow up, but it's not.
No, that makes sense. Thanks.
Melissa, I'd love to see an effort to reach out to faith communities of all traditions that can take up this advocacy work.
Yeah, so the ARC, we work a lot with different faith-based organizations. Generally, I lead something called the Disability and Aging Collaborative, and we have agencies that are faith-based, and certainly we work with groups like the Jewish Federation and Catholic Charities we just did a letter with. So those are things that we're doing actively, and I know within their communities they're also working on it. We've also though been doing a lot to make sure that we are expanding outside of just the disability community. The ARC has been working for the last year with the National Domestic Workers Alliance, Caring Across Generations, the National Women's Law Center, Moms Rising, Family Values at Work, a variety of organizations. If I started listing them, I'd forget them, but forget some, but with what's called the Care Can't Wait Coalition. And that coalition is really combining the issues of home and community-based services, both access to services and workforce, with childcare, with paid leave, and all of those issues being joined together has really been helpful to keep the drumbeat going. And so I hear you, Melissa, because I do think it's really important. I know too that Ellen and the folks at the ARC of Massachusetts worked on a big coalition letter to send up that did include a lot of different, or a wide variety of organizations. So I know that that's something that, but would encourage you to all reach out to your contacts in your state.
Yeah, it's important. I mean, just to make sure that we have a broad coalition working on this and not just disability groups. That's a great point, Melissa. Thanks. Where do those letters go? I'm not sure. Do you mean the action alert letters, Paula, or what? I'm not sure what letters you're referring to. We sent a letter to the, as Nicole just mentioned, to the Massachusetts congressional delegation about the Better Care, Better Jobs Act.
And
So you were talking about earlier about sort of letters that state kind of what the home-based services means to you or your family, and that's what I was referring to.
Sure, yeah, and so you can fill those kind of things in through the action alert, and those go directly to your legislators' offices. So, so it's a way to reach out to your legislators. The ARC is actually, I'll give you some hot off the presses information. We know that during the recess period, there's going to be a lot of attention paid to who goes and talks about a specific issue at an event or at a town hall or that sort of thing. And because of the Delta variant and everything else, and sometimes of inaccessibility of events for people with disabilities generally, that could be difficult for a lot of people with disabilities, family members, et cetera, because of high risk. And so just like we did, folks might not remember this if you weren't around part of the ARC network in 2017, but in 2017, we did 2 weekends of letter writing campaigns. We're going to do it a little bit more sophisticated because we've learned a lot and have some more staff, et cetera. But we're going to be working with our friends at Caring Across Generations and others in Care Can't Wait to do an all care voices count kind of campaign where we ask everybody to write a letter about why these things matter with your state. And then we're going to do a big delivery at the end of recess to show that while we might not have, I know for my brother, he wouldn't be able to show up to a town hall, but he still needs to be counted. And so we're going to be doing that as well. So, so there'll be lots of opportunities to share your stories. But those letters from the action alert go directly to your legislators, and we'll make sure the same thing is true with this All Care Voices Count campaign. And obviously we'll be sending out a lot more about that. I'm just developing it, so it's gonna, just figured I'd mention it since it came up.
Great, thank you, Nicole. And I see, Melissa, you're just adding more organizations. I think that's really smart, that we should be doing more outreach. And, you know, as Nicole mentioned, letters to the editor, op-eds, are all some stuff that we could be doing. And the ARC of Massachusetts certainly could help with that if people want to work on it themselves, and we can do our own and, you know, take what the ARC of US has done already for templates. So, but it's all great that people want to get involved in this. It's such an important issue. And I don't know if people want to open up and unmute themselves to ask additional questions now that we have Nicole and Sara on. You're welcome to do that as well. You don't have to just put it in the chat box.
Ellen, I have another question. So obviously we're seeing that there's differences across the state in terms of the workforce crisis. And I'm wondering if the $400 billion in funding will have flexibilities in there, because we're hearing from some provider organizations that, you know, sign-on bonuses and retention bonuses and minimal rate increases are not going to do it. A lot because there are no bodies available. And so some of them are saying, you know, what about funds that will help us basically bus people into our region? And you know, it's not just in southern Massachusetts, but other areas as well. Do you think there will be flexibility within these funds?
The way that they drafted the legislation was very intentional to make sure that there was a lot of flexibility at the state level. I mean, that's a very specific scenario, so I wouldn't be able, and frankly, because there's so much flexibility, just like with the American Rescue Plan Act funds, there's likely going to have to be a plan, or there is going to have to be a plan, right? That's part of what needs to be submitted. So sure, if that's something that the Massachusetts DD agency or Medicaid agency thinks is a good idea, they can include it in their plan. There's certainly nothing that would disallow something like that.
That's great. And how about, I heard, I think Sarah mentioned the 2% increase that would be temporary F bump. Why is that temporary?
Well, I can say that the ARC submitted comments along with a lot of other organizations suggesting that it at the very least be longer term. But that's where a lot of the labor components are. I don't know, Sarah, if you wanted to jump in on that.
Yeah, I'm also not sure why. And it's something that I think, you know, my boss is interested in the possibility of extending that, if not permanent, at least to increase the time period that it's available, because we know that the kind of policies that are in that 2% bump will require building some infrastructure on the state level, and we want to make sure that there's sufficient time incentive, like for a sufficient time, so that states want to opt in, and then have enough time to build that infrastructure and kind of get these new systems, or get the new programs stood up. So I think it's a really important flag, and it's something that I think we're conversations over here about for sure.
Great, thank you. That's really helpful.
Can I ask what the version is, as I couldn't find it in the House, because I didn't see the companion bill, at least on when I looked it up on thomas.gov. Is that, I just want to make sure all of our Massachusetts reps are in support of this.
I have the internal document. I don't know if it's right on congress.gov, but I'll check.
Okay.
Last time I checked, it looked like Presley was on board. It looks like everyone is on board except for me, Moulton, I think.
Okay.
Yeah, the bill is led by Congresswoman Dingell, and I can find the bill number for you right now.
It's a HR 4131,
Okay.
yeah.
Okay, and we can
Here's
update
a link.
and let people know.
Here's a link, and it should have the co-sponsors. But they're doing a big push this week, too, just so you know, to get additional co-sponsors. We have, I think, close to 100 at this point.
Great. Well, thank you both so much for joining. You had some great questions.
Thank you.
Oh, okay, you've got it. Thank you for sharing that link. And yeah, if there are any other questions, we can move on to our state updates. But thanks again, Nicole and Sarah. We really appreciate you joining. It's very helpful to hear from you. I think people are really excited about this bill, and it's definitely needed across the country and in this Massachusetts for sure. So we got good support on the sign-on letter. So until people are motivated to do more in the advocacy on this. So thank you.
Yeah. Thanks so much, and I'm happy to be here. You know, this is a really important issue for the senator, and I'm sure she would want to communicate that, you know, this isn't just Senate doing a thing. As you guys know, it takes a bunch of folks rowing in the same direction, and you know, thank you guys for all the work that you're doing to push for this, to identify the needs early on that, you know, led to developing this piece of legislation. Just really grateful for all your work, and hopefully all of us will keep the fight up and get this over the finish line later in the fall.
Thanks, Sarah.
Thank
Thanks,
you.
everybody.
You guys keep up the great work.
Bye, everybody.
Bye. So I know we're going to go over in time, but we just want to go over some quick state updates. So I'll let Maura go.
Okay, thanks, Ellen. Yeah, I'll be quick. We met last month. It was a smaller meeting, so I'm kind of going to go over some of the things we talked about last month. I think people were on a little more vacation mode at the beginning of July. But the good news is our final budget is in, and you know, all along you've been hearing us say that we were grateful for the increases that continued throughout the process. And in the end, we did end with the $29 million additional funding relative to the 3 line items that we had requested for increases, and additional increases that we hadn't requested. So we did really well in terms of DDS. We know that obviously there are so much more needs for funding, and mostly now related to workforce. So some other good news is that the $500 million in federal home and community-based services funds, it has come through the American Relief Plan, and we have begun the process of the first phase, which is $100 million available to provide immediate funding to our workforce. Which, you know, is wonderful and fantastic news. But as soon as you dig a little deeper and you see that the salary increases that this money brings is actually tied to utilization. And that's a problem because, as you know, many of our day programs are not even close to at capacity. So to be able to bill more, but only relative to your capacity, is not going to help them get staffing back and get their programs up and running. If you have a full functioning residential facility and you're getting the bump, that's great. And the other money is going to recruitment and retention. It's all wonderful. It's such a positive thing for the state. But we have to remember there are some areas, like I mentioned earlier, that no matter how much sign-on bonus or a retention bonus, there just aren't people available. And I think we're starting to see that across multiple areas in Massachusetts. I'm hearing about like incredible long lines at, you know, places like Target and other places because the workforce is just not here. So, and with the Delta variant and some guidance coming in last night actually from DDS, you know, getting our workforce in is not going to be easy. It really isn't. So although we're really happy to see this, there's going to need to be a continued effort around advocacy for the workforce. And I know it's hard to be patient because right now I'm hearing from so many people that say, what can I tell my legislator? How can we help? And we've been talking to the legislature. We wrote letters to Ways and Means for their hearings around this money. And obviously they've been hearing about our workforce crisis for many years, really since 2017. We don't have our official ask yet for the legislature, but Ellen and I and Charlie and Leo and the team, we're all working on that to have something very much available by September. We did want to see how this $500 million is beginning to be utilized and to really understand the plan for that money as we formulate our ask. So hang in there. We will definitely have a very concrete ask, and it will likely be tied to rate increases. Whoops, Ellen, can you move me? Oh, maybe I can move me. No, you have to move me. And I'll just quickly go over this because not too many people were on last month, but I think many of you heard that the Federal Appeals Court overturned the use of the electric stimulation device that's currently being used at the Judge Rottenberg Center in Canton. And this was kind of a big hit to those who have been working really hard to extinguish this type of treatment and potentially close at least that part of the work that's being done at that facility. So last month we went over all this, but this month I just wanted to remind people that we are behind a bill. It's called H225, an act regarding the use of aversive therapy, filed by Rep. Danielle Gregoire. It has been a priority for the ARC for many sessions. We've just been, actually, it's one of the few bills that we've actually never even moved out of the initial committee because the children, families, and persons with disabilities just was, I think, very torn by the testimony that came in around this bill through the parents and the family members that have their loved ones at JRC. So this year, we do have a change up in the chairs. There's 2 new chairs of children and families. There's new people on the committee. And with this appeals court overturn, I think there's been a whole lot more grassroots efforts going on to bring awareness to this issue. If you've been following social media, you'll see there's a Stop the Shock hashtag going around, and you can sign a petition through that. That's not the ARCs, but you know, happy to see people signing on to that. And again, we should be going to hearing in the fall with H225. So if people are interested in sending in testimony or potentially testifying, beware, it typically is a really, really long hearing. They set aside kind of a separate hearing that only has this bill and a few others to try to manage the timing on it. And be in touch with me if you're interested in providing testimony in support of that bill. And also, last thing I'll say about that bill is there are not too many reps signed on to this bill. So if you do feel really strongly about it and you want to contact your rep about it, let them know, you know, to co-sponsor the bill. It's only a few so far on there. So that's all about the aversives bill. Can you go ahead and turn the slide? Oh yeah, back one, great. And then I just wanted to kind of recap what's happened this summer for people. We had a really busy summer of hearings. We knew it was coming, but it just, you know, we didn't know which committees were going to go to hearing, and then it was just like boom, 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 boom. So we had those 5 committee hearings, plus some written testimony, as I said, to Ways and Means regarding the ARPA funds. And I would say with those 5 hearings behind us, it's really time to check in with your legislator, because they are now in the process of reviewing all of those bills that went through the hearing already. So you can use our action alert. We have 3 bills on that action alert, which is the accessory dwelling unit bill, our disability commission bill, and the higher ed bill. So if you can, pop onto the ARC and send your legislator a note about that. And then lastly, just coming in the fall are some of our really big hearings. We have children and families and persons with disabilities, which will incorporate at least 5 of our bills. And then we have public health and healthcare finance and a couple other committees. So if you have time, take a look at our advocacy page, take a look at our bill priorities. If there's something that really speaks to you and your family, just be in touch with myself or Ellen or Charlie, and we'll help you figure out how, you know, your best way to advocate. I think that's it. And I'm sure, you know, if people have questions, I can take them after, Ellen, if you want to talk about the tech.
Okay, yeah, there's one in the chat box.
Oh.
In-home staffing, I think it's supposed to be AFC, ECA are eligible for increases in, yes. We're talking about ARPA, I think if we're talking about ARPA funds, which I'm assuming this question is about, yes, you are correct. Yes, it covers those things.
Yep, and I'll put the link in right now. But you can take it away, Ellen.
All right. So yeah, I just wanted to let people know, and I know that we're way over in time, so I apologize. But we really wanted to get that Better Care, Better Jobs Act update. So on July 19th, our Innovation and Technology Task Force, which is a partnership with DES, ADVP, and the ARC, we released our technology forward report and recommendations. And so just want to make sure people are aware that it's finally released. It's been a long process, but we're really proud of it and excited about it. It's directed to the commissioner, Jane Ryder, and we're asking for a multi-level initiative to enhance supportive technology. And supportive technology in Massachusetts is basically devices and technological methods that are used to increase independence and community integration for people with disabilities. And that includes assistive technology and remote supports and monitoring. That's a specific definition for Massachusetts. And we're requesting DDS to build the supportive technology competency and capacity And then we outline recommendations to develop a pilot program for supportive technology. And, we're hoping with the third part of the ARPA funding that this technology initiative will be included in that. We don't know for sure, but that's what we're hoping, that's what we've asked for. As Maura mentioned earlier, we submitted testimony to the Ways and Means Committee that was reviewing ARPA funds, and that was one of the things that we recommended to the committee for the supportive technology to review our report. The DDS has already made some changes. Sorry, my slide I can't see. Hold on. Is basically they've done we've done for both of the budgets, fiscal year 2021 and 2022, we have a $500,000 line item for supportive technology, which was part of the ask that we initially made in our task force with DDS. And through that, for last year, they were able to develop, or at least the fiscal year 2021, they were able to develop 11 grants for different organizations to promote or to be advocating for supportive technology. And that one of those grants was something that we received. We received one of the 11 grants, and we developed our tech center website, which is a resource for technology. And I'd gone over in the last webinar, so I don't need to do that again, but we just a reminder to check out our tech center website, because we're constantly making updates to it and reviewing different types of technology that we want to promote for our community. And in addition to that, DDS has proposed for the 3 adult waivers, the HCBS waivers, to include new supportive technology amendments, and that's something we hope that will be, that CMS will approve. So that's my quick update of technology. But yeah, we definitely recommend checking out the report and recommendations. Something that we worked on specifically with TDS staff. So we're optimistic that this is something that the DDS will and HHS will follow through on. So we're excited about it. And if you have any questions, feel free to contact me or Leo about the report. And so that's it. That's all we have for today. I don't know if there's questions. We can open it up. I mean, Maura and I are more than willing to stay on for as long as you guys want. Is there anything in the chat box? Okay, that's.
So I have a quick question.
Okay.
This $100 million to go towards increases, has that dropped or it's coming?
We're in that phase right now, right?
It's in what phase?
That's the first phase of the ARPA funding implementation. And I mean, I think that they're just starting to provide guidance to agencies about implementing that money.
Yeah, Ellen, can you stop the share for a second?
Sure.
I find it so hard to answer questions.
Yeah, no, I understand.
Yeah, I think what ended up happening too is that in anticipation of these funds, providers already started spending that money. So they are very, very anxious to get these, they started putting out the recruitment and sign-on bonuses. And so, yeah, the pressure is on, and that money should be getting dispersed, at this time, this month. Any other questions? You guys are all of a sudden silent. Well, it's great to have such a huge group today.
It's fun. I know, especially for August. Thank you for joining us. I know it's hard to schedule things.
Sorry, I'm not as fast a typer as I'd like. I just was wondering if you have a history of working with Greater Boston Interfaith Organization.
No, Maura, have we?
No, not that I know of. But it would be, like we said, really great to, I mean, one of our goals is to reach out beyond the disability community. And so any connections you can make for us would be fantastic.
Okay.
Definitely.
Who should I be in touch with?
You can reach
Be in
out
touch
to
with me
Maura
or
or
Ellen.
me. Yeah, either of us.
Yeah,
Okay.
I'll put my email in here in case.
Okay, thanks.
That's a great idea, Melissa. I think that's really important to have a broader coalition. And we do work with different groups on various projects, especially like around I can say for the 2020 census, we work with a huge variety of groups. So, but yeah, it's really important in our advocacy to do that. So thank you. Thank you for making any connections. All right. Well, thank you, everyone.
Thanks, everybody.
I appreciate it.
Stay well, stay safe.
See you in September. Bye.
Bye.